Hi, I'm Dr. Veronica. This is AskDrVeronica.com webinar series. And guess what? Yes, again, we're going to talk about sex. You know that everybody thinks about two things in the world, I think. Only two things. Money and sex. And practically everything in life goes back to money and sex. Well, you have seen some of my Think Rich and Die Poor series. This is my sexy series. And I want everybody out there to have good sex. It's very important that you have good sex. So I've rounded up, as you see, lots of experts in different areas of sex and sexuality. So we have this big problem going on with women, and they call it low libido. And so what we're going to do in this webinar series, and for people who are listening to the teleseminar, is talk about low libido. Now, what I did is I found someone just through, you guys know I'm social media medicine, through social media, I found this woman. Her name is Kim Whittemore, and she is on the board of directors of the Institute for Sexual Medicine. And the Institute of Sexual Medicine is a nonprofit organization to help people with their sex and sexuality issues. And so you have doctors on there, and you have other people on there who specializing in helping people get rid of sexual dysfunction, define even in the first place if there is sexual dysfunction, and making us all happy and joyful because we're having good sex. Now, one thing that I learned, and after talking to my friends, is there are people out there who don't feel like having sex, both men and women. But lots of women don't feel like having sex for various reasons. And so we all get lumped into that category called low libido. Well, we're going to talk about what that is. What is low libido? Should it be something that you're worried about it? I'm going to assume since you are listening to this webinar series, you're either a woman with what you think is low libido, or you're a man who has a partner who you think has low libido. We're going to talk about all those issues. But the woman who, besides being on the board of directors of the Institute for Sexual Medicine, has had some, let's call it major league problems in her life with her libido and sexual function. And we're going to talk about those during this webinar, because when I found her, I felt like this is a gold mine, because not only does she have background knowledge about sexual function and dysfunction, she also has personal experience and a very interesting story to go along with of how she's been through it and how it's been treated, all the things that she's gone through. Some interesting things that she's gone through that even me as a doctor, I haven't seen them. But she's going to tell us about those. So we're going to try to figure out for you today how to work through this issue we're calling low libido. Now, at the end of the webinar, we're going to give you some resources so that if you're having these issues, you know where to go to get good information. Because one of the problems with this is you step into your doctor's office, and first of all, you don't even want to talk about sex and sexuality with most doctors. Okay, I know pretty much, well, I have good doctors that I want to talk about sex with, so I'm lucky, but I'm a doctor, so I know how to pick it. But most people go into their little white coat man and feel silly, embarrassed, ashamed talking about sex and sexuality. Now, you guys know me, Dr. Veronica. Practically every other week on my shows, I'm talking about something that has to do with sex. So here we are. So I'm going to bring in Kim Whittemore, and we're going to start this conversation. Hi, Kim. How are you?
I'm great, Dr. V. How are you?
I'm very good. Now, did I leave out anything about your background? Is there something else you want to highlight before we get into this?
I think the most important thing for people who are watching and listening is that I'm a patient first. And so in becoming a director on the Institute for Sexual Medicine, it was really at the request of my doctor of sexual medicine. And up until a couple of years ago, I had no idea there was such a doctor. So I was pretty much going to a general practitioner or my gynecologist and finding it very, very difficult to talk about some of the things that were troubling me. And I found that the doctor was equally uncomfortable bringing up issues or having the conversation. So I guess to really summarize how I got here, on my 31st birthday, I found out I was going through menopause.
Wow.
And that's, wow, not good. Not a good birthday gift. And I'd only been married for about 4 months. And stunningly enough, within a very short period of time, I had all of the symptoms that anyone would think about that goes along with menopause. And it was a quest of 20-some years before I actually found a doctor who was able to look at the whole person and look at me in a holistic way and figure out just the complexity of all the things that were causing me to have, I wouldn't say no libido, I would say no libido. Sex was the most painful thing you could ask me to do, and I would do everything in my power to avoid any kind of emotional contact, connection, or touch, because I thought, oh, holy crap, if I have to have sex now, it's going to be the worst thing. I'd rather give blowjobs for the rest of my life than deal with this.
So, okay, we're going to talk a little bit more about sex and sexuality and low libido and using some of your examples. But first I want to go back. You said, my doctor of sexual medicine recommended that I do this, be on this board, and that's how I got involved. First, I was an ophthalmologist, and there's an American Board of Ophthalmology. I've never heard of sexual medicine as a specialty area. So can you clarify for the listeners, the watchers, sexual medicine doctor? How do you become a sexual medicine doctor? What are the background? How does one find a sexual medicine doctor? How do you know that this doctor is qualified for you to talk to?
It's interesting now, and this is new. It's a pretty new phenomenon. If you actually have access to the internet and you literally Google Doctor of Sexual Medicine, Institute of Sexual medicine practice, you'll find clinics popping up all over the country. And the universe of doctors that are knowledgeable in this space is relatively small, because there's very little training in medical school even now for sexual medicine. There are gynecologists, there are urologists, but in terms of sexual medicine as a discipline, it's still not wholeheartedly recognized and accepted. So it is a little tricky, and I can provide a number of websites where people can go that are not-for-profit based that will talk about various doctors and clinics throughout the country.
Okay,
but one of my...
Well, I was going to say, we're going to provide those at the end, because I want people to listen rather than going on Googling, because we're all on our computers. But we'll provide at the end some of those resources that we're going to what we promised people already, those resources. So now, so people can go and Google them, but how do I know once I hit that Google what I'm going to get when I go to this doctor of sexual medicine?
Sadly, you don't know. And unless you can find data that other people have provided. So I'm very, very active on social media websites and Yelp and Health Grades and other sites where doctors are evaluated to provide my personal opinion of how I've been treated. And I think that's a first step, is to just look at the data that's out there and literally query that doctor by name, because there are doctors of sexual medicine who I've spoken to as recently as last October. I addressed the International Society for the Study of Women's Sexual Health. And the organization has what I would describe as kind of the rock stars of sexual medicine and sexual health. And believe it or not, they asked me to come to their meeting to specifically talk about what it feels like to be a patient and what kind of treatment I've been getting historically from doctors when I've been trying to talk to them about my concerns and my distress over my sexual health issues. So it's been very... I think it's been a rude awakening for a lot of the docs to hear what it's like. And I think one of the biggest problems we still have is, even though doctors are learning a lot about sexual health and sexual medicine as we go forward, and there are a number of classes that you can find on the internet that are continuing medical education classes for docs, they're still not really being pushed into this area. And the doctors that are moving into this space are doctors who feel very strongly that this is a critical issue. So it's really kind of the trailblazer doctors that are pulling the rest of the medical community and the insurance companies along. One of the other challenges that you would understand very clearly is that many of the treatment options that doctors recommend for women that have low libido are non-FDA approved. And the treatments themselves...
Explain what that means, non-FDA approved.
Well, if you're not approved by the Food and Drug Administration, then the drugs that the doctor may prescribe for you are not reimbursable by your insurance company. So let's say you finally get up the nerve to go to your doctor, just your family doctor, and say, sex is incredibly painful, or I can't even be aroused, I can't stand to be touched, I can't stand to have anything inserted inside me, from a tampon to a penis. And let's just say you finally are able to have that discussion with your doctor, which is great. And kudos and claps to all of you for doing that. And let's hope that your doctor is able to sit still and not squirm and listen. Then we need the doctor to either be knowledgeable in how to treat you or to be able to refer you, hopefully within your if you have insurance, to someone who can treat you that's in that network of doctors that you're already subscribed to through your insurer. If the doctor that you see who knows sexual medicine is knowledgeable, he or she is very well aware that treatment options that are working for people like me have not been approved by the Food and Drug Administration, and that process can take years and cost a lot of money. Yep. So what the doctor does oftentimes, and in my case, and we can talk specifics, is I have certain drugs, or I actually have a testosterone pellet implanted in my butt cheek, and it helps me tremendously. It's not approved for this use in women by the Food and Drug Administration. So my doctor can perform this procedure. It's done off-label, and therefore I have to pay for this, and there won't be insurance coverage.
Okay, so now I got a little bit back about insurance. What I want to do is I want to pull it back, way back to the beginning, and let's talk about low libido, because we started talking about people like testosterone pellet. Wow. Okay.
Yeah. Whoa, I ran to the end. Sorry.
Way down at the end.
Sorry.
The end. And people are saying, I hope nobody clicked off and said, no way, I'm not doing that. I'll keep my low libido. Okay. No, that's not what we're going to talk about. Let's talk first about what by definition is low libido. You hear it thrown around. Women, I know just through medical training and studying normal human physiology and having an interest in myself and sex and sexuality, that there are differences in how you feel about having sex during the month. There are differences in how you feel like having sex throughout life. Some more, some less. And on top of it all, there are people who are more wanting of sex, and that's their normal being, and there are people who are less wanting of sex, and it's in a bell curve. So let's talk about first the definition of low libido, and then talk about some of the normal cycles that I just mentioned, so people can start understanding about their body, for women to understand and also men to understand this, so when your woman says, I don't want to do it, even though she might some other time, you'll kind of get what's going on. Low libido, definition.
Yeah, actually, low libido falls under this sort of general heading of female sexual dysfunction, or FSD. And there are actually 7 classifications of female sexual dysfunction. So, I can take people through all 7, and even though it sounds a little medical, there are words that may ring true for someone that's listening or watching. So I think it's worthwhile. Okay. The first one, and and let me just start by saying that in the few studies that have been done, recent studies about low libido and female sexual dysfunction, it looks like there are upwards of 40% of women who have some distress, and that's the definition of female sexual dysfunction, is something that causes you distress or discomfort. So, and that number is probably more like 60%.
Okay, so here's the thing that's important for people to get with this low libido thing. If you're not having distress or discomfort, and you're just a person that you just don't want to do it as much, and you're happy about it, by definition, there's no dysfunction.
That's correct. And unless let's say that you're perfectly happy with the state of your libido and you're in a relationship with your partner, whether they be male or female. If that lack of libido is a change and or causes distress or concern to your partner, then it's probably going to cause distress or concern to you. But yes, if you are perfectly content and you're not feeling any distress, any pressure, and you're not active or there's not a lot of discomfort, then you're fine. Yes. I mean, there's not a problem here.
Now, I want to make one point about this also. I think people in the general population need to understand, with your partner, you're both not going to feel like having sex all the time. And there's
Correct.
always going to be somebody who wants it more and somebody who wants it less. So
That's
you may
very
think,
important.
And when you change partners, that changes. So with one partner, you may be the one that wants it more. With another partner, he or she may be the person that wants it more, and then you're the person who's the low partner. So you may have this perfect flow going, and how you feel about it may depend on whether your partner is going all the time. They want it every day, 6 times a day, and you just want it once a day, every day, which is still quite frequent. But there are other people who once a week is absolutely fine with them, and that's normal for them. So people,
I look at it as some kind of a dance. I like the analogy of a dance with whomever your partner is, and you just figure it out. What are you dancing, and how frequently and how often, and don't step on each other's toes, and that's a compromise, or that's a discussion. So, yeah, I think that's a very healthy way to look at it. But if you really want to get to the clinical definition of female sexual dysfunction, the 7 categories go something like this. The first one is a mouthful. And the initials, the acronym is H as in Henry, S as in Samuel, D as in dog, D as in dog. And it actually stands for hypo as opposed to hyper. So hypo is underactive sexual desire disorder. And that sounds like it could be the catch-all for everything. But what hypoactive sexual desire disorder is in a clinical way is absence or deficiency of any kinds of sexual fantasies, thoughts, or desire for and being receptive to any sexual activity that causes personal distress. So HSDD has this personal distress. So your libido is not there, or you just are completely absent any thoughts or fantasies or interest in sex. Period.
Okay.
That's HSDD.
All right. Let me just ask one question. You may be able to answer this for people. Sexual fantasies. What percentage of women have sexual fantasies?
The number from what I've read is quite high. It's in the 70 to 80% range, but that's an anecdotal study. I think the way that we look at HSDD and all of these other sexual dysfunction categories is it's been a change. It was something and it changed. So if you had these in your 20s and suddenly or gradually in your 30s or 40s or 50s, there is a change, and that change causes you distress or discomfort, you fit the bill. And that's why I think the number is very high.
Okay, so 20s, 30s, 40s, 50s, and beyond. Does sexual desire change dramatically through one's lifetime?
It can, for a whole slew of reasons. So if it's okay, I'll go down the 7, see, kind of what they sound like, because they're different and they have different causes. Another classification of sexual dysfunction, if you will, is called sexual aversion disorder. That's actually more fear-based. Mm-hmm. And so it's actually a recurrent or persistent fear and avoidance of sexual contact. And that actually is very debilitating to someone. So it's not just that you lack the desire, you're actually fearful of and go to great lengths to avoid. So that's sexual aversion disorder.
Okay.
There's also something called sexual arousal disorder, which is your inability to attain or maintain any kind of sexual excitement. Okay. And it could be subjective, so it's kind of you thinking about it, or it could be lack of any kind of genital response to stimulation. So when you are sexually stimulated, there is a natural lubrication that comes in your vagina. There are secretions that come that ready you for your partner's penis. I mean, it's just so it's not dry and rough and uncomfortable, and it's actually a physiological and a mental reaction to stimulation. There's also increased blood flow that goes to the vaginal area and the clitoris, and we actually get this kind of swelling from the blood flow that increases sensitivity, and it's called engorging. And so if you are incapable of achieving those physiological responses to stimulation, that's an arousal disorder. And the reason I think it's valuable to go through each of these is because there are different treatments depending on which of these you have. And you need to have a doctor that knows about these things, that can talk to you and figure out what the root cause is or what the root causes are, and then treat you accordingly.
Okay, now that was 4 you already gave us, yes?
That was only 3. That was hypoactive sexual desire disorder.
So we could talk.
Yeah, I'll hurry. More, so there's a couple more that are, and I'll do them quickly. There's an orgasmic disorder, which is it's almost a muscle control, a Kegel muscle, and you can't attain or maintain and achieve an orgasm. There's something called dyspareunia, which is actually very serious. It's painful. It's genital pain upon intercourse. There's vaginismus, which is an involuntary spasm of the muscles outside the vagina, and those also those muscles, if they can't respond properly, affects stimulation as well. And then there's a sexual pain disorder that's non-coital, which means you have genital pain even if you don't have anything inserted inside of you. So those are the 7, and that's a lot, but it's the reason it's worthwhile going through them, even if they seem a little bit overwhelming, is that these are actually medical diagnoses. So when you say low libido, I want the listeners and the viewers to understand low libido is very complicated. It's not just about I'm not in the mood. And if low libido is a cause of distress for you, or if painful intercourse or inability to achieve an orgasm when you used to is any cause of distress, there are medically defined conditions, that are legitimate and that do have insurance coverage associated with them, and that there are treatments for. It's just that the treatments are slower in coming because it's been much, much easier to deal with low libido and erectile dysfunction in men because it's so simple. In women, it's very, very complicated, as evidenced by these 7, diagnoses, if you will.
Okay, now I want to just jump right on one of the diagnoses. I'm trying to think about the things that I've heard going through my medical career and from friends. One of the things is arousal. Let's talk about arousal for a second, because a little bit more than a second, because arousal is one of those things where people are wondering what's normal. Should I be aroused before I'm touched? Once I'm touched, how should I be aroused? How long should it take? Where should I be touched to be aroused? I think I could be aroused with my shoulder being touched.
Yeah, right.
Okay, so let's talk a second about arousal, because I think that with arousal, a lot of times with partners, I want to say there's a mismatch. So one person's thinking, he doesn't excite me, or the guy's thinking, I don't excite her. Talk a bit about arousal.
This is a scary area, because we're gonna have to go down the masturbation path here, and I have to say that I did not masturbate. Perhaps I did when I was much, much younger, but for the most part, I had unsatisfying sex for most of my life. And the first time I was ever given a sex toy and achieved an orgasm was only a few years ago, and it was at the hands, not literally, of my doctor of sexual medicine. So I think if you are not in touch with your body, and if you've never masturbated, or if you've never been touched in a way that brought you to arousal, it's really hard to say you have arousal disorder, because it's comparative. It's comparing what your arousal was with kind of where it's gotten to now. It's a comparative, it's a comparison diagnosis. It's almost like my eyes were 20/20 and now I'm feeling a little nearsighted or a little farsighted. So I think unless you know that you like your nipples touched, and that when they're touched, they get hard, or that you like your vagina or your clitoris stroked. And some of us don't even know where these parts are. I mean, that's a whole nother,
got that right. That's what I found.
We'll get to that because frankly, until my doctor had me spread my legs and showed me all my private parts on a 42-inch plasma screen, I didn't know what he was talking about. So if we're not comfortable with our bodies and we're not in touch with these, if you want to call them erogenous zones or areas that respond to touch, it makes this diagnosis pretty darn hard. Okay, I think that I don't know if that's helping or making it more complicated.
I want to ask a couple questions. I know a lot of these answers personally, but I want to ask for the benefit of the audience. Masturbation, very hot topic. What percentage of women masturbate? Is it normal, not normal? And I can tell you there's a differential between men and women. I know that. But women and masturbation.
I don't have any data that I am comfortable quoting that addresses women and masturbation. And sadly, there aren't a lot of studies, though there are, it'd probably be best if I got back to you on that, because there was a study done that I don't have the findings for when the Eros device was brought to market, and that is an actual device that's used to help create more blood flow and stimulation to the clitoris and the vagina, and it's a $400 device that doctors actually can write a script for.
Wow.
And there were studies done that showed how that device helped women that were having difficulty. It still didn't address how many women masturbate.
Okay.
So
now,
it's very hard to say.
All of these type of studies are what we call anecdotal. Well, not
Correct.
anecdotal, but they're reported, okay? So a lot of times when we're talking about sex and sexuality, a lot of the things are underreported because people are so touchy about talking about this subject because they believe it's taboo, lots because of cultural and religious reasons. And here in the puritanical United States, we feel that way. Now, from what I've seen in passing reading, I'd say they say 45 to 70% of women masturbate.
I have seen numbers in excess of 50%.
Yes. Whereas for men, it's usually more around the 90 to 95%.
It's in the 90s. Yes.
Okay? So there's a difference, and realize that you're thinking, oh, God, it's because men are dirty. Well, guess what? Their sex organs are sitting right down there, and they look at them all the time. They've been looking at them since they've come out themselves, okay? Whereas
and looking at each other's in the urinal.
Yes, and comparing. Whereas women, a lot of our sex organs, most of our sex organs pretty much are hidden, okay? Yeah. And so the areas that tend to be the most sensitive are hidden away, although they are accessible. And so when we learn about sex and sexuality, in school, when they teach about sex, they never say, this is your clitoris and it's highly stimulated and here's where the G-spot is. And
I know.
We don't talk about that level of sex. We don't talk about the relationships. We don't talk about what the span is of normal types of sexuality. For a lot of people, hearing these things that we're talking about now, it's the first time that they've heard it, and they may be in mid-age and beyond when they're hearing it. But
that's why I like to talk about it too, because I am that person, as you and I have discussed. So I did not masturbate, and I did not use any kind of a sex toy until my doctor gave me one after using one allowed me to have an orgasm a couple of years ago. And I now use it almost every day and sometimes more than once a day. And I don't think there's anything wrong with that. Some of my girlfriends do.
Censor up on this webinar now.
They'll have a big, oh no, Ghostbusters, or a skull and crossbones. But I have given this particular device, I've probably purchased 35 or 40.
I'm still waiting for you to send mine in the mail, by the way.
I know, yours is on order there. Back order. No.
On back order. Okay, so
you're getting the attachments.
Okay, so let me just say, when I first met Kim, she said, I got to send you a Hitachi magic wand. Okay, now we've seen in books these Hitachi magic wands, and I'm like, well, what's the big deal? She said, oh, I need to send you one. It's on back order. So I want you people to know if it's on back order, that means there's popular and there are lots of people who are using it. So
they're
that means that
quite popular. They're probably
nobody's doing this. If you think nobody's doing this and that you're alone, people are. And in addition, I've read this book called America Unzipped, which talked about the sex and sexuality of what was going on in America. And it really showed, lots of people are having sex toy parties and demonstrations in stores and things like that. Yeah. So if you really believe people may not be talking about it openly, but people are out there, they're interested in sharing information. So we're trying to share some more information, not about necessarily the Hitachi magic wand, which Kim endorses highly, okay, but that these devices out here are important because in order for women to know what arouses them, you can't expect your partner to figure it out. They may,
and a lot of times too. Oh yeah, I'm sorry. Go ahead.
You have to know your body. It starts with knowing your anatomy. You don't even have to go to the bookstore and look at books on sex and sexuality now. You can order them in the privacy of your own home. So every woman, if you're wondering about your body, go on Amazon, go on barnesandnoble.com, order a book, look at the anatomy in the book, and you need to find it on your body. You need to find it on your body. I mean, let me just tell you one piece of anatomy that you need to understand about yourself. Okay, women have babies, and they urinate, they have intercourse and all this other type of stuff. Okay, you pee and you look down, the pee comes out. Well, guess what? That's coming out of a different hole, the urine, the canal. Then your vagina, where you have a baby and you have sexual intercourse. Those are two different places. Now, when you look down as a woman, you can't see that. Two different places. Okay, so let's just start realizing that where you're urinating is different from where you're having sex and where the baby is coming from.
Yep.
Okay, and when you look at all women don't look the same. Their vagina doesn't look the same. The lips on the outside don't look the same. The clitoris doesn't look the same. Everybody looks different. So if you're wondering, how come my friends are having this great everything and I'm not, it may be that you don't know your body. And once you learn your body, all of a sudden you're able to experience pleasure. Now, one of the reasons for me doing this type of seminar and some of the other webinars you're going to see is because I think there's not enough good information or frank talk about bodies and sex and sexuality out there. Okay. So a lot of women complain, I don't feel like it. That's why we're talking about low libido in this one. But if you check out some of the other webinars, you're going to get some of the fun on the how-tos, because the how-tos are important too. And I mean, there are whole books. There are whole books on how-to for women and how-to for men. Books. Okay. And so the reason why there are books is because we are all different and we need to figure it out. Okay. So having said that, let's ask a few more questions of Kim. Low libido. Okay. Causes of low libido. We're going to stay with the big term just to facilitate things. What are some of the causes that you know of low libido? Is it all physical?
No. And in fact, if you were, many of the causes are psychological and are related to potentially being subjected to child abuse, being a victim of rape, which was my case as well. So not only did I go through menopause at a young age, but my first sexual encounter was as a freshman in college, and it was rape. Wow. And it was in the middle of the day, and I willingly went into someone's fraternity. So that is, a big cause right there. And aging can affect libido, just kind of the natural course of aging and menopause. I'm looking at my little cheat sheet here because I want to keep it official, as opposed to keeping it really personal. Hormonal changes can happen as a result of birth control pills. Yes. They can happen, and we have hormonal changes throughout our menstrual cycle anyway, but and our interest, as you said earlier, does increase, decrease, or fluctuate during pregnancy, during our monthly cycle, and I think we know that. I think we feel an increase in blood flow, or we're sensing and our bodies are responding to our periods and know that we're getting ready for intercourse and the ability to have a child. So our bodies are doing that anyway. And you've got all kinds of things like estrogen and androgens, which are testosterone, that affect your libido, if you will. But one of the things that women really need to know is that there are certain antidepressants and very often birth controls that can bring on and change our hormone levels, cause vaginal dryness, and lead to painful intercourse.
Okay, now, do you know any of those offhand that you can share with the audience?
I know that a decrease, I think almost any birth control pill can potentially, it will decrease your estrogen level, and it can throw you into perimenopause or menopause. And that's well documented. So
Yes.
I think many times women who are on birth control pills will subsequently either come off those pills or will find a wane or a decline in sexual interest. And it's actually, if their blood levels were drawn and their hormones were evaluated, they would see why.
Yeah, well,
it would be clear.
Yes.
I don't know if I'm answering you.
Yeah, the way birth control works of basically, stopping things like ovulation means that you're not going through the normal cycle. You cannot get
Correct.
pregnant. But guess what? What happens when you ovulate? You feel like having sex around that. So normally, hormonally, there are certain times of the month where you feel more like having sex. And so let's just, for argument's sake, say that you have a 28-day cycle. Now, the people's cycles are a little bit different than 28 days, but let's use that. We always use that for argument's sake. If you're at day 14 of the cycle, starting from day 1 is when the first day of your period, and you're at day 14 in the middle of the cycle, that's when you're expected to ovulate. Guess what? Right surrounding those days, that's when you're going to feel most like having sex.
Of course, our bodies were made that way.
You feel like having sex. Your discharge changes. You're more interested in men. Guess what? Even studies show that women who are ovulating, they've done studies on women who are adult dancers. They get higher tips when they're ovulating. Okay?
Yeah.
So this is something that nature has made this way. You feel like having sex, and males can perceive that you are fertile at that time. So that's why it is. The other time that women tend to feel most like having sex is actually right before their menstrual cycle, right before it happens.
Mm-hmm.
Okay? So realize there's this waxing and waning. Now you might say, well, I want to do it all the time. But if you really start paying attention, you're going to realize that there are some times that you're, at least I do, absolutely crazy and I got to do it. And there's other times when you're just like, oh, well, I'll do it, but I could do without it. Okay? And that's because of your hormones. Now, so I wanted to put that in. What about life cycles? There are times, everybody thinks that sex is for the 18 to 25 age group. But for women, their peak sexuality is not there. Is that so?
It's closer to, it can be late 30s and well into the 40s when women have a higher sex drive. And so you're right in the sweet spot there. Yay, go Veronica, go Veronica. But and I think again, for me and for my friends, when we talk about these things, and I talk to women who, range in age from 16 to 70 plus, I see women, and I just met a woman on the plane the other day, and her sex drive at 65 is the same as it was when she was in college. It's consistent.
Only Kim would talk to 65-year-old women about sex on airplanes, but go ahead.
Well, we got on a whole, because I'm out doing research all the time. I'm doing my own research. But, I wanted to come back to the arousal thing, because if a woman, because we're talking about hormonal changes as you described during menstrual cycle, when a woman is sexually stimulated, there are actual physical things that happen to your body. Your blood, and this is documented, your blood pressure goes up. Your heart rate, your breathing, and your temperature go up. Your nipples, the labia, which are the lips that sit outside your vagina, which is where you either insert a penis, a sex toy, or deliver a baby out of, your labia and your clitoris, which is above all those things, fill with blood and become more sensitive.
Yep.
And your vagina lubricates and it expands to accept the penis. So we're these really, no pun intended, well-oiled machines that are meant, we were built to give birth and have babies and
sex.
Build up the army and have sex, and it was for a purpose.
And
so
I want to point out the and have sex, because there's a lot of people that think you're only supposed to be having lots of sex during childbearing years, and guess what? All this doesn't turn off after 35. In fact, there's actually an uptick for lots of women Like I said, life begins at 40. And when I tell people life begins at 40, it's because, whoa, okay. And let me just comment on that from a physiologic standpoint. In actuality, women who have had children can be more sexually aroused because the blood and blood flow is going to that area more. So a lot of times there's things about you in your life. You might say, I'm young. That's when I'm supposed to be having sex. You haven't had children or anything like that yet. Guess what? Your body really isn't necessarily primed for the best sex of your life yet. Okay. And it may be that after you've gotten rid of the children is when you get primed, because sex is not just here for procreation, it's there for enjoyment. So after the children are out of your head, i.e. 40 and beyond, is a lot of times when women start enjoying sex.
That's what I see. What I'm seeing, and I think is also documented fairly well, is that once the children reach a certain age, and in my case, I was never able to have children on my own. So I can tell you my sex life now far exceeds, or my interest and desire far exceeds anything that I experienced in my 30s. In fact, my libido is what it was in my 20s.
Okay, so would you just share with our audience so they know at the time we're recording this your age range, just so women can understand?
I'm 55. I'll be 56 in October.
Okay, so women, if you're hearing this, it's normal to have a healthy libido over 25 and even stronger than when you were young.
Yeah.
So understand that is something that is normal. And many times over people's lifetime, their libido does not decrease. Sometimes it can even increase. Okay, because people think as you get old, you're drying up and you're losing interest. Okay, now let's talk a bit about drying up. What causes women to dry up just in the natural course of life?
When it's typically a result of a hormone imbalance, and there's a very delicate relationship between estrogen, progesterone, and testosterone. So you have this kind of delicate balance, and as we age, we also have a situation where we have only so many eggs that we were born with. And as every time that we go through a monthly cycle, those eggs pass through. If they're not fertilized and we're not creating babies, then they just keep passing through. And at some point in time, we stop ovulating, the eggs stop flowing, the lining of our uterus stops building up to receive that egg, because the brain is trying to tell us, send an egg, and there's no eggs to come. The uterus is normally building up this lining to receive the egg and the sperm, if in fact there's going to be a pregnancy. And then if there is no embryo created, if you will, or no egg and sperm insemination, the wall of your uterus is shed, and that's your period. So as we get older, no eggs, no lining, no periods. And a lot of us say, wow, isn't that really great? But when that stops happening, then the vagina gets less, there's no blood flow, there's less activity, there's no lining built up, and then vaginal dryness can occur. So our brain and the rest of our body parts are confused and don't really know what to do, and we start to change, our hormone levels start to change, and we go through this kind of odd scenario that is either perimenopause or becomes menopause. And that can happen. What normal is for menopause, what age is normal is really a moving target right now. We can go through menopause. I think the typical age is in the 50s, but you can go through menopause in your late 30s and still be considered not abnormal.
Yeah,
and
I think it is in the 50s. And just an aside point about that for a sec, women who are out there who are older, who are thinking about childbearing, I always say go for it. And the reason why I say go for it, because if you're still ovulating, obviously that means that you possibly can. And if you weren't meant to have kids when you're that age, you would have stopped ovulating long ago. So when everybody says you're this age, you shouldn't have kids, don't listen to the dogma. Now, do risks change? Do risks change? Yes, risks do change. But let me just tell you, some hot off the press research shows that people who are very physically fit actually have younger bodies and younger reproductive systems than people who are not physically fit. I have talked to GYNs, OBGYNs, who have told me they rather have an older, healthy woman than a young, fat, out-of-shape woman. And so women, if you are really thinking about childbearing, maybe if you're not married, if you're thinking about marrying older, or you have married older, or you've decided at a later age in life that you want to have a child, physical fitness is important for this endeavor. You are more likely to have a healthy, normal child if you are physically fit. This is what research is now showing. They've done research in these areas, and guess what? The other thing, I want women to also understand this, because it takes some of the onus off women, that the health status and the physical fitness of the father of your child is exceedingly important. This is all what research is showing now. It's not just all the women, it's also the father, his physical fitness, and his age too. Okay? And so when you're looking at somebody and you're thinking about childbearing, take those all into account. But I just wanted to say, if you're still ovulating, go for it if you're thinking about having a child, with the right healthcare professionals to help you do it the best way possible. Sorry, just had to put that in.
No. That's I think that's a really good point. And I think that a lot of people underestimate the role that physical fitness is going to have in their overall health, in addition to the sexual health and well-being.
Now let's talk about physical fitness and libido. Any correlation there?
I have only, this is very anecdotal, but I've seen studies that go in both directions, surprisingly enough. So you can't think of stories where you've got people who are very intense dancers or are involved in something where they've probably been depriving themselves nutritionally and are very, very thin, almost to the edge of anorexia, where sex is, there is a change in libido and a change in desire that's for the negative. Okay. So, and there are also women athletes who are generating, if you will, and or supplementing with testosterone that can have a higher libido. So there's nothing there. The correlations are anecdotal, but this is a really, I think, an important area for some additional research.
Yeah,
and I think we'll probably see some.
There's not lots of research out there.
No.
Even if you see someone who looks like the model that you see down the runway with no hips or anything like that, a lot of times women like that do tend to have more fertility problems. But there is the female athlete who doesn't particularly look like that, but because she is in such fabulous shape. Now, these are not usually people who are until you get to like Olympics and all that other kind of stuff. You're in such fabulous shape.
Right,
that
elite
although
athlete.
You don't look like that, you have so much muscle mass and so little fat, because estrogen is stored in fat, that you're not producing enough hormones to be fertile. Okay, so there are a couple different body types that you may see this in. So if you're not having regular periods and you're physically active, there is likely an issue, and that's when you need to see your doctor. So now I want to jump back to other causes, psychological causes of low libido, where we're talking about abuse and things like that, emotional causes, relationship causes, hormonal causes, Okay, those are all kind of lumped in. Let's talk a little
stress,
bit.
a lot of stress, depression.
Bad relationship, your guy's unemployed and you feel bad about it, emotional. Let's talk about, and those are all valid reasons to have lower libido, okay? Let's talk about mechanical, because you had, let's call it mechanical problems. What
Correct,
are mechanical problems that cause your, it sounds like you didn't just have a low libido, you had also the aversion.
Yeah. What's interesting is, I think what might be helpful is to talk about what the challenges were for me, and then, if we have time, talk about how those were diagnosed, because they're two completely different things. But the net result of my issues, some were psychological because of the rape and because of a complete lack of awareness and understanding of my own body, of other ways that I could stimulate myself or be stimulated and respond, factored in. So I had this kind of emotional, psychological piece. As it turns out, my hormones were so out of whack from going through menopause early, and the hormone replacement therapy and the various regimens that different doctors prescribed for me were inconsistent. And so as I moved and went to a new doctor, I would get different advice. And then when a study came out that was done by the Women's Health Initiative in the 90s saying specific type of hormone replacement therapy was bad, I think quite a few of us foolishly just stopped our hormone replacement therapy cold turkey, and we needed those hormones to help us with our bones and our bone density and our overall strength and wellness. So, this isn't, you just can't stop something cold turkey without thinking through all the implications of it. But I had something called labial resorption. So actually the lips that are outside the vagina have a purpose and are another source of stimulation, and one side of my lips completely was absorbed back into the skin. You can't even see it. It's not there anymore. And that was an early indicator to my doctor that I had inadequate estrogen. I also have a very hard time metabolizing testosterone, and what a lot of women don't realize is that we all have testosterone. Mm-hmm. Yes. It's a natural hormone. It's in our bodies, and how we metabolize it is very important. So a doctor of sexual medicine knows not only to look at how much testosterone is out there in your body, but there's another blood level that doctor can look at that looks at how that testosterone is used by your body. And in my particular case, I needed much more testosterone to just bring my level to a place that would be normal for other women. And this isn't that uncommon. Okay. Another huge challenge for me is that just like we have trigger points, where you might get, in your shoulder, or you probably know from running a lot, in your calves, and you get these knots and these tight muscles that you have to work out. Yeah. I actually had a series of trigger points inside my vagina. Wow. And if a tampon, a penis, any other foreign device got in there and hit one of those trigger points, I would have tears streaming down my face. This is not unusual. But the treatment is relatively new. So what happens in that particular case is I had to have a physical therapist who is trained in pelvic floor, because they're dealing with the pelvis region of your body, pelvic floor physical therapy. And what that involves specifically was she had a series of vaginal dilators. They're not sex toys. They just look like candles of graduating thickness. So the smallest one was about the size of my pinky, and then go up, the next size, that was extra small, then medium, then large. And what I had to do, first I did it with her because I didn't know what I was doing. She would insert her hand in a surgical glove inside my vagina, almost like a sock puppet, and she'd get in there and she would work out these trigger points, basically trying to fatigue my muscles so they would relax in the same way that you would have a massage to work out the knots. She's working out my vaginal knots. Who knew? And she's working those out. And then eventually she said, rather than me coming for physical therapy and expending, time and money to do that, she wrote an order for me to buy these vaginal dilators, and I was able to use them in the comfort and privacy of my own room. So I started with the smallest one, and I would insert it, and I would exert pressure and kind of push on the places where I felt those knots until they would just tire and relax. And I cannot tell you what a difference that made. Because that in and of itself, that was actually worse than the dryness and the lack of lubrication that I had from a hormonal imbalance. So the pelvic floor physical therapy was huge. The other thing that my doctor checked me for, and this is how I learned about the masturbating and the sex toy, is that I went through a series of treatments with my doctor at San Diego Sexual Medicine, and everything seemed to be normal. I felt great. In fact, I feel great. I have energy. I'm optimistic. I have libido. I feel like my body is I don't feel like I'm having this crazy out-of-body experience. I feel like I'm inside my body and it's mine, not my brain is inside this thing that's not me, that I can't control, that I don't understand, that just feels like, an old dry burlap sack. So I went through all these tests, and he said, okay, so how is sex for you? And I said, I'm not having any. I want to, but I'm not having any. He said that we should do and stop me if I'm going way off track. He wanted to perform a clitoral ultrasound.
Yes.
So
we're going to go about 10 more minutes. So I want people to hear these type of things, because I want you to know some of the things that are available, because as far as I'm concerned, Kim has been through practically everything I could think of that I've ever heard of and more. Okay. So let's go back. Clitoral ultrasound.
Well, so if you think about, having an ultrasound or to look at a baby or anything along those lines, it's not invasive at all. Mm-hmm. A clitoral ultrasound for women is critical because there's such a high incidence of heart disease in women. And so let me just run over to men. Really?
Well, what does heart disease have to do with your clitoris?
Okay, I want to draw an analogy. If a man has erectile dysfunction, it means he has constricted blood flow in his penis. If a woman is not responding in some cases to arousal or she's not able to achieve an orgasm, a clitoral ultrasound will show blood flow to the clitoris. In a man, if blood flow is constricted in his penis, it's sort of the canary in the mine that says, wow, if there's plaque there, then there could be an issue with arterial plaque and blood flow throughout the body. The same holds true for women. Who knew? So you can do a clitoral ultrasound in a calm state, and you can look at what the blood flow looks like, and are there any constrictions? And could me, for example, because I have a history of high cholesterol in my family with my mother, and also for myself, despite my diet and exercise regimen, which is pretty intense. So we performed a clitoral ultrasound, and there was not constricted blood flow, but what my doctor wanted to do was see what would happen with much more rapid, intense blood flow as a result of orgasm. And I looked at him like, what the heck are you talking about? And that's when I saw the Hitachi Magic Wand, which is a fairly good-sized device. It's conical. it has a plug on it, so it's not like some little thing that you run around with, and it has a big ball on the head. They put a surgical glove on it, and embarrassingly enough, I looked at the nurse and I said, that's not going to fit. And she said, you knucklehead, you don't insert it. Of course, because I thought, well, now I know what's wrong with me. If that's supposed to fit inside me, I have a big problem. I mean, that's how embarrassing this was. So she gave it to me. I said, look, you're going to have to show me exactly where my clitoris is and where the heck I'm supposed to put this thing. She did. She left the room, and my doctor said that given how all my test results looked, that I should be able to have an orgasm in 5 to 10 minutes. 2 minutes and 35 seconds, I am orgasmic. They run back in the room. They look at my blood flow. There's no constriction, which is great. And then they felt so badly for me, they gave me the Hitachi magic wand. And that's how I found out that I have a very high sensitivity to clitoral stimulation, and that I can no muss, no fuss, no makeup, no nothing, no drama, no dinner. I can just use that, and I am able to achieve an orgasm in less than 5 minutes.
Okay, stop. I want to highlight this for a reason. What age were you when you had that orgasm?
53.
Okay, so I want women to hear that, because women feel like, well, if I haven't had an orgasm, that's it. Guess
Best
what?
orgasm I ever had.
Okay? 53 years old. And she's just discovering this, all right? So do not despair, women out there, if you feel like, I want sex, everybody's talking about it's all the rage, and I don't know what they're talking about. There are things that you can do to go through. Now, I want to finish up in 5 minutes, and in the 5 minutes before I finish up, what I want to do is I want you to go through as methodically as possible some of the workup that people should have going to. Think about this blood test. If that's normal, go to this. If that's normal, go to this. Some of the things that you've gone through. And I'm not going to go into all the treatments, because there's going to be a million treatments, because there's a lot of different problems that people can have. So Kim talked about having a testosterone pellet, which is an off-label use of testosterone. Know that there's things out there like that. And know, as doctors, we use most medicines off-label, meaning the FDA approved it for one thing, we use it for something else because we figured out it works. Okay? Go through some of the workup so people can have an idea of some of the questions they should be asking their doctors.
Well, I think that the first thing that a doctor would do, and many of these doctors of sexual medicine will do a free consult, 10 or 15 minutes, and they'll ask a series of questions. But the treatment involves, one, doing I will call it a psychological assessment. And there's, I call it the happiness scale, but there's an official acronym and term for this, and it's in the materials that I'll reference at the end of the call. But it's a sexual desire index, and it's a questionnaire, and that needs to be administered to kind of see where you're at, what level of distress you have, etc. The doctor will typically order a series of blood tests that at a minimum involve your estrogen, progesterone, testosterone, and your sexual hormone binding globulin, which is how your body uses testosterone. These, and your DHEA, which expands to something that's got too many syllables.
What about things like cholesterol, thyroid? Should those be checked?
Your doctor should do a thyroid workup and should do what's called a lipid profile to look at your cholesterol as well. And if you've already got those from your primary care physician, then those would just carry over with you.
Okay.
Then
we didn't mention this, that some of those things, having the high cholesterol, can herald that. Also, thyroid dysfunction, which is quite common, can also cause
very common.
Things, okay? So if you fix those, let's assume those are all fixed and normal and you're having problems, then you start looking at the sex hormones. What other type of workup should people be looking for?
Well, when you come into the doctor's office, these doctors most of them don't even use a speculum, those metal things they keep in the refrigerator and shove inside you and open up to do pap smears and things. They don't even use those. So in my doctor's case, and most of the new clinics, they have big plasma screen TV. My physical exam involved the doctor testing my sensitivity to hot, cold, and vibration. And the way he did that was he put a device on my finger, and then I told him when I could feel the temperature change. Too hot, too cold, and also when I could feel vibration. He put that same device vaginally and did the same exact test, and the difference was shocking. So if I could feel something on my finger in 2 or 3 seconds, it could have been more than 20 before I even felt anything, which told him that I had some serious sensitivity and blood flow issues. I also was tested for my pH. So if you think about your body's alkalinity and acidity, it's a little out there, but there's just a little piece of litmus paper that a doctor can use to basically look at what is happening with your vagina and draw some conclusions based on that. Then a physical exam and your ability, he'll be able to look at you anatomically. He'll look at your vagina. He'll look at something called your rugae, and he'll look at whether you're pink or white. So think frostbite when you go almost white and the blood flow is stopped.
That's right.
The less blood flow you have vaginally and clitorally, the more signs the doctor's going to see. And unless we're sitting around with a mirror and we've got a point of reference of before and after, we're not going to see any of these things. So a complete exam and showing you what's going on is critical to me. And these are all steps that the doctor will go through: psychological, hormonal and blood level, physiological, to come up with a treatment plan that works for you.
Okay, and I wanted to highlight that for the webinar watchers and listeners, because you will notice that what Kim has said is very different than what you get when you go for your regular yearly GYN exam. Very, very different. So if you are having low libido, you are having sexual dysfunction, it is a completely different workup and discussion than just going to get your yearly exam. Now, what I want to do now is, a lot of my webinar people have special offers that they want to make to people. And I'm going to tell everybody that Kim says, I don't really have a special offer other than I want to point people to the resources. And so what Kim's going to do now is tell places and websites and maybe books that you can go to get good information about that, where you can start exploring your sexuality, your highs, your lows, your dysfunctions for that. So Kim, give us some information about that so people, nice and slow, spell if it's anything complicated.
Yeah. And these are all on the internet. So if someone doesn't have access to the internet, and you're comfortable with this, Dr. V, you can give people my cell phone number, and I'll take calls from anybody that's feeling any kind of distress or concern about this.
Let me just tell everybody what we generally do is after the webinar finishes, we're going to have information that you're able to click and get to. I have all the tech people doing all this stuff. Okay. So as Kim's giving you information, we're going to be taking down that information so you can know exactly where to go. I'm not going to put Kim's cell number on because she could potentially be deluged with millions of calls. But, I mean, Kim, don't you have a website?
No. The only website that I steer people to is www.sexualmed, so it's sexual, MED, .org, and that is the non-for-profit website associated with the Institute for Sexual Medicine, and the head of the institute is my doctor. His name is Dr. Irwin Goldstein, and he is one of the most respected doctors in the field of sexual medicine. He's the editor-in-chief of the Journal of Sexual Medicine, and he's really a rock star in the field. He was involved in some of the clinical trials for female Viagra. He's always out there looking for treatment options and then working to get them through the Food and Drug Administration. And at his request, I actually testified in front of the FDA last summer at a hearing to say, even though I'm not a candidate for this drug, the FDA needs to do more to help women that have issues with painful intercourse, low libido, etc. So www.sexualmed.org is a great place to start. There is the Women's Sexual Health Foundation, another great website. It's www.T for the, W for women's, S for sexual, H for health, F for foundation.org.
Say that all together.
It's TWS as in Samuel, H as in Henry, F as in Frank, .org. That's the Women's Sexual Health Foundation.
Okay.
And even though I have 10 or 12 more, all of those two sites will take you to every other site. But I want to mention a third site that I feel very, very strongly about, and I've done a number of videos for. It's www.empower, not empower, but empower. It's EMPOWHER.com. It's a beautiful site. There are quite a few communities. It's women's health in general. Sexual health is covered there, as is anything else that could possibly befall you. There are personal videos. I think I have 10 or 12 videos up there before I came out of the closet. So it's just up there as Kim W., not with my last name, because I was embarrassed for quite a long time, and I just wanted to help women but not put my name out here and alienate my clients. But what the heck now? Too late. Genie out of the bottle. But anyway, Empower is a beautiful site, and as you go to any of these three sites, they'll reference other sites. The thing that you need to be very careful of is that if you're looking at studies, they're scientific, they're peer-reviewed, meaning 4 or 5 or 6 or 2 or 3 different doctors got together and wrote the study, and you can look at the clinical trials. You don't need to be a doctor to understand a lot of these write-ups. Okay. And you'll be able to see what's coming, and you'll be able to see what words and what statements and what stories maybe resonate and ring true for you. And then you can follow. But even on Empower, people can email me on that website. People can email me on the Institute for Sexual Medicine site, and I will get them to somebody who can help them. I guess
now let me just ask. I don't know whether you have this information or not. Half of my listening audience is actually international, and so I want to ask for people who are not in the United States, are any of the doctors that you know or professionals that you know available for consultation across the internet or phone or in another way if people happen to be in another country and want to get information?
I know that many patients outside the United States are calling my doctor in San Diego, and I would bet that if people went to sexualmed.org, that it would be relatively easy to, like I did find a doctor for someone in Western Europe, and it was very easy to do, and I found a doctor for someone in Australia. There is an international society for the study of women's sexual health. It's www.isswsh.org, And again, I think any one of the other three websites, and certainly sexualmed.org and twshf.org, have links to other doctors and other providers throughout the world. And so you can, once you get into one of these sites and you can look at the resources, you can extend from there. But I'll email you a couple of things that you can share, Dr. Veronica, on your site.
Absolutely.
That people can just click on, and I'll make sure to be certain that I'm including the international resources as well.
Absolutely. And so I want to thank you, Kim. Thank you so much for sharing your story. And I'm going to have to make it a point to get your guru doctor on and pull him on and know what else that we can talk
amazing.
about that are interesting so people can hear. I wanted people to hear a personal story from a woman, though, who's been through a lot and has practically had everything under the sun to check out her sexual health. So, Kim, I want to thank you very much for participating in this Low Libido for Women Ask Dr. Veronica series. Thank you, Kim.
Thank you, Veronica. I really appreciate it. It was a pleasure talking with you.
And I want to thank everybody for listening to the webinar. And always check on AskDrVeronica.com because we have lots of interesting subject matter that you can partake in all areas of your life, not just sexual health for women, but for men, on other areas of your health, on relationships, and even, yes, on money. So I'm Dr. Veronica. Thank you for joining.